Hello and welcome to a special collaborative episode between Social Media Docs, SoMeDocs, and Daily Remedy discussing stigmatizing issues in healthcare, known as Stigmatized. Today we're here with Dr. Joseph Parker, emergency medicine physician and general medicine physician with a special focus in addiction medicine, who recently went up against the DEA only to find out that the legal system is quite, let's say, difficult for physicians. And with that, I'd like to welcome Dr. Parker.
Thank you very much.
Dr. Parker, your story is very interesting, but in getting to know you over these past few months to years, your resiliency is even more interesting and more fascinating. So for the listening audience who may not be aware of your writing or aware of your story, can you first begin by talking about how you got yourself into the situation with the DEA when you were a practicing physician just trying to focus on addiction medicine?
Sure. I came to medicine through a more circuitous route than most. So I grew up on a small farm in Arkansas. We had altogether 10 kids, and we were not wealthy. So to go to college, I needed to find a way to help pay for it. So I joined, an uncle had been in the Navy, and he recommended the United States Marine Corps, and I did some studying, and it looked like of course, you're 18 years old, it's a cool uniform, and you get to hang out of helicopters. So I signed up, and I was able to finish a bachelor's degree while serving on active duty with the 1st Marine Amphibious Brigade. And after I completed my Marine time, my active duty time, I was in the Hawaii State Sheriff's Department for a brief time while I waited for a slot in the Air Force. Now, a lot of people don't know it, but Marines don't have doctors. The Marines use Navy doctors, and I had a family by then. I didn't want to be on a ship for 6 months at a time, and so I wanted to be an Air Force doctor. So I switched to the that's my daughter. So I switched to the Air Force and decided that I'd try to go ahead and further things there. But there were some prerequisites that I had not been able to get finished while in the Marines. So the Air Force said, look, if you will go into missiles, we'll pay 100% of whatever you want to study, and if you get into a medical school, we will give you a scholarship. And it worked out wonderfully. The military has been fantastic to me. And so I worked as I was trained as an ICBM commander. There was at a time, serving at Malmstrom Air Force Base in Montana for a little more than 3 years while I got my prerequisites done and applied to medical schools and got accepted in a very good one, the Mayo Clinic. I did my medical training there and then started my emergency medicine training, later becoming there's a lot of life happens in between, but I later became the director of emergency medicine and trauma at one hospital, and then went on to, they needed general medicine doctors also. So I went on to run some general medicine clinics, first for the hospital and then on my own. General medicine in Arkansas requires pain management. Every doctor in the state of Arkansas, according to the Arkansas Medical Practice Act, should treat chronic pain as a normal part of their practice. That's in the law. So I started treating pain. With that became an awareness of addiction. And as I started studying addiction, an addiction specialist, a psychiatrist, said, hey, will you help me start a Suboxone clinic? And it was the first one in this area. So I went to Harvard for further training. I studied under him and helped him open that clinic. So I got into addiction medicine. And I found, contrary to what I had been taught and had expected in the emergency room and everything, most addiction patients are some of the best patients you'll ever have. They're very dedicated to getting better. They're not at all the problem patients I had expected. And so I enjoyed that aspect of it. I started doing more of that. I dedicated 2 days a week. I worked 6 days a week. So 2 days a week was dedicated to addiction treatment. 1 day here in my hometown and 1 day in a bigger town nearby. And I took the board review course in addiction medicine 3 years in a row, and I was looking to become board certified in addiction medicine when they came into my addiction medicine clinic and put handcuffs on me.
Wow. Talk about that ordeal.
It was a huge shock. We've all been aware that there has been a politicization of medicine that has been occurring probably since about 2010, sort of a creeping interference, I'll say, by federal law enforcement, where they want to dictate the practice of medicine because they think they know what's best for everyone. That's what governments always do. It's not specific to the American government. The problem is the American government has pretty much unlimited access to taxpayer dollars. So when they do something wrong, they can do it wrong better than anybody else on the planet, right? So they really do it wrong big time. And so we had seen physicians being arrested, being charged, and the tendency is to always assume that was a bad doctor. He must have been choosing to be bad. He must have had criminal intent. He must have known that he was breaking the rules and chose to anyway. Otherwise, they would never go after him, right? And you couldn't convict someone, and this is something that I knew to not be true. You can convict an innocent person. In many ways, in the American justice system, an innocent person is at greater risk than a guilty person. A guilty drug dealer knows they're breaking the law. They plan for the day that they get hit. They will roll over on other people because they have lots of other people to roll over on, right? And our system is set up to reward people who are guilty with criminal knowledge. Our system is not set up to protect the person who is innocent with no criminal intent. As a matter of fact, you will be hammered for having the temerity to suggest that you aren't guilty. Because once they point at you, there is only one option. They never back up and say, we made a mistake. And if they spend $250,000 investigating you, they want a conviction. They want to justify what they've spent. And they won't say, we were wrong or the informant lied to us. And that's something that I've studied over, I think, 400 cases now of physician prosecutions. And the common theme is that they rely too heavily on the statements of people who obviously have an incentive to lie. And they are so incredulous as to be willfully blind or knowledgeably letting these people lie. Because there are records that are in their possession that prove that the statements are not true. Yet they let these people make these statements under oath in front of grand juries and at trial. It doesn't seem to bother them a bit. And that, I have to say that was a bit of a shock to me. I thought committing perjury was a very big deal in this country. But only if you're not doing it in a manner favorable to the government. And I say that with great sadness. I served this country to protect against the Soviet Union and the kind of things they used to do. And I hate to say that I see parallels between us now and them back then, but I clearly do.
Talk a little bit about this concept of using false statements either to initiate an investigation by supporting an indictment or supporting a conviction through the legal proceedings itself. And as you and I both know, I have personal experience with that as well. I don't think the general public, particularly the medical community, really understands this concept of using as the basis of evidence.
I don't think they want to believe that it's true. And actually, I don't either. I just have no choice but to know that it's true once you've seen it. So what they will do is they want someone that they will have leverage on. So they will observe your practice, scan the patients you see, and in my case, apparently set up fake marijuana legalization surveys on street corners so they could get the names and address of my patients, right? As well as the plate numbers and whatever else. So they had cameras set up watching the place. They had these people stop people and say, hey, are you in favor of medical marijuana? Well, if you're in favor of medical marijuana and you've got severe chronic pain and it's not yet legalized in your state, or if you go across the state line, which in my case, the city is right on the state line, there's a chance there might be something in your car. So once you sign that, they get your name. They can either look to see if you have a past conviction or stop you on a pretext. Say they smell marijuana, search the car, find something, and then say, if you can tell us something about, say Dr. Parker, we can help you. Otherwise, your whole life's over. You're going to lose your kids. You're going to lose your home. You're going to lose your job. You're going to jail. And people get scared, and scared people are very prone to doing what's in their own best interest, even when they know it's a lie.
It's fascinating, this notion of abusing or exploiting health policy or health advocacy to further a certain legal means is quite pervasive in how the government approaches physician prosecutions, and general investigatory principles really seem to show a consistent pattern. In your research of these 400 or so cases, can you discuss some of the patterns that you've seen,
Sure.
particularly along the lines of these false statements?
They developed these techniques because they were necessary going against organized crime. So when you're going against organized crime, you're dealing where pretty much everyone's a criminal in that organization. They know they're criminals, they choose to be criminals, and they don't want to talk. If you can't get someone to talk, then you can't move up that chain. So they learn to use leverage even when it wasn't accurate. And that's allowed in the United States, just like they will tell, say, a murder suspect, we have DNA from the scene, it's your DNA, right? They're allowed to do that. Other countries, you're not allowed to lie to a suspect. But in the United States, you can. And that's why we have such a high false confession rate. But they developed these techniques for organized crime where everyone was guilty, and they did not modify the techniques. So they don't look at a medical practice and say, is this doctor a good doctor or a bad doctor? They've already run some kind of algorithm or metric. They've already targeted you. And now they're not looking for a reason to prosecute you. They're looking for an excuse, and they will create that excuse. So patients will come into your office. If you're in a state that has medical marijuana legalized, they will come in and say, hey, I need a prescription for this marijuana. And then my insurance says they'll cover it, right? Well, first off, the patient's lying if you've done your reading, because no insurance is going to cover medical cannabis. Secondly, you can't write a prescription. That's still considered a federal Schedule 1. But they're trying to get you to do something that they can use. One of the things that they will do is come talk to you and scare you. So there was a doctor in Arkansas, Dr. Cox, elderly woman. She was practicing general medicine, treating pain, treating anxiety. And they came and said, did you give this person a prescription for Xanax in a parking lot of a Walmart or a McDonald's? And she said, no. Bang, you're hit. 18 U.S.C. 1001. You've now lied to a federal agent. Because they knew you did it, because they had the Walmart video and all that. And you may not remember in the stress of that moment that you did. And then you can call them and say, oh, yes, I'm so sorry. I forgot about that. Well, now you've just confessed to lying. You're done, right? So she went to prison for that prescription, right? So they are looking at doctors who are treating a lot of pain, who are prescribing a lot of opiates. And we had 75 cancer patients that we were actively treating. Oncologists would routinely send us cancer patients because we had psychologists to counsel, we had general medicine, and we had me trying to take care of controlled medications. So our numbers were high. That's all they care about. If your numbers are high, or they think you're vulnerable. They think there's something that they can hit, or their algorithm kicks you up. And I hate to say this, but their algorithm is racist as Hades. You look at the doctors who are being prosecuted, and it's like they're 40% black when 18% of the U.S. population is black, and it's a lower percentage of the doctors that are black. They're black. They're from India. A huge number are from India. They're Jewish. And I'm not saying they don't go after Caucasian doctors too. I'm just saying that the algorithm is flawed. It's very flawed when it comes to racism. I'll give you an example. One of the criteria for the algorithm is apparently, are you associated with anyone who has a felony conviction? In which case they're going to consider that you're more likely to be searched at a higher rate, arrested at a higher rate, prosecuted at a higher rate, convicted at a higher rate, and put in prison at a higher rate. 1 out of every 3 African American males over the age of 18 has a felony conviction. 1 out of 3. So if any black doctor has 3 or more black friends or relatives, odds are at least one of them has a criminal conviction. Bang. The algorithm looks at that and says, hey, he's associating with criminals. He's probably a criminal. And we know false convictions and all that take place, or there's disparities in prosecutorial discretion, police discretion, and all this. But it adds up to a flawed metric. And they recognized this when it came to bail and stuff like this, when the BBC did a big article on it. But it really hasn't been recognized and publicized yet. about how they're targeting doctors.
Why do you think that's the case?
I don't think they want to see it. I think they just want a metric. They said in their writings, the Department of Justice said there was no way for us to go through all those medical records and all those prescriptions ourselves, so we had to design an AI to do it. So then 2017, I think is when they had finished the AI, and they called it the Beast. I did not do that; they did. And the maker of it, which is a specific company I could name, that using the smarts of health insurance companies and the book smarts of health insurance companies and the street smarts of the DEA, we have created a beast of a program. It's time to release the beast. And that's what they did. They basically set this thing out and said, tell us who's a bad doctor. Well, who's a bad doctor? According to the insurance companies, anyone who costs us money. You do any genetic tests, you're on the list. You do GCMS urine drug screens you're taking, instead of just benzodiazepine, you want to know if it's Xanax, Ativan, or diazepam, you're a bad doctor. And all of these criteria come together to generate a list where you may not be breaking the law in any way. None of the 12 criteria that they listed in a 404B filing that they said described a pill mill, none of them were illegal. They say he took cash for prescriptions. Well, used to cash meant cash only, green dollars. Now they count cash as in debit cards and credit cards. Well, of course, those are trackable. And doctors don't have to take insurance. Or the law doesn't say you have to, but they will prosecute you if you don't. Now, before, it was assumed that the cash meant you were trying to hide any transactions. But if you're taking debit cards and credit cards, everything's trackable. So there should be no problem with that. And there are insurances that doctors don't take because they either don't compensate well enough to keep the doors open, or it's too much trouble, or they're just not in network with. But these are some of the arbitrary criteria that they have decided makes you a bad doctor.
Dr. Parker, you have uniquely and skillfully managed to elucidate so many of the issues and just the general misconduct on the part of the government, particularly when it comes to targeting physicians. Myself and many other physicians, when we try to advocate or at least explain the situation, we often find ourselves not believed, or people ask us, explain what had happened, and then inevitably it comes to, oh, well, why did you do this? Or why did you do that? And you find yourself almost parsing through details, almost justifying when the person you're explaining to has a preconceived notion that you must have done something wrong. Has that ever happened to you? And what is it about your advocacy that makes you uniquely effective?
I hope that I've been effective. I feel like a man who's fallen off a cliff and he's screaming on the way down to make sure he's heard before he hits. There are things that they do that I started recognizing a pattern in. First off, they call everyone Dr. Feelgood. They will tell the media that you were known as Dr. Feelgood. The media will publicize that you were known as Dr. Feelgood right after your arrest. By the time you go to trial, they will say, do you know that you were publicly known as Dr. Feelgood? Well, of course you were. They're the ones who said it. They're the ones who put it in the media. No one had said that before about me. And so they have a method that they follow, right? So they destroy you publicly first. You are pilloried. First off, there are deaths associated with your practice, doctor. Is that not true of every doctor except maybe a few pediatricians and hopefully a dermatologist? Who does not have patients who pass away? And I was treating sick people. Sickle cell anemia, cancer, of course. The surgeon who does surgery on brain cancer is going to have a terrible failure rate. Half of his patients are going to be dead within a year, most likely, right? That means he's a great doctor if only half are dead. The surgeon who only does breast augmentations, if he has a 0.1% death rate, something is terribly wrong, and you better take a hard look at that guy, right? You have to look at the patients, and that is what they do not do. They just look at the numbers. Matter of fact, they said in my case, they said in their public release, they said, we ran the numbers and saw immediately that he was an overprescriber. That means they didn't take out the cancer patients the CDC says doesn't count. Now, I have issues with the CDC guidelines and morphine dose, milligram equivalents, and all that. But even if we were to consider that they were all 100% accurate, You've got to take out the cancer patients because one pain patch for a cancer patient can be 200 morphine dose equivalents. And you've got to take out sickle cell. You've got to take out palliative care, which they conflate with end-of-life care, but that's not what it means. It means we can't fix what's wrong with you, and we're trying to make your life tolerable so you can have some quality of life and some function. It doesn't mean you're about to die. That's hospice, right? So all of these techniques that they've developed are very effective, very effective. So they've already put in the paper that deaths were associated with your practice. They've already tainted the jury pool. And then you've got media, like painkillers and all that coming out where every doctor is just a greedy, self-serving, unconcerned about his patient, ne'er-do-well. And everyone is primed. Then they talk about what you own, the car you drive, right? They said, you drove a Tesla, didn't you, Dr. Parker? Well, no, I drove a Prius, but we had a Tesla, right? Dr. Anand, they said, you drove a Volvo. I'm sorry. The man spent however many years in school to get to where he's at. Can he not drive a Volvo? I will guarantee you that the Assistant United States Attorney that prosecutes doctors probably makes as much or more than most of those doctors they prosecute. Yet they throw your income up to generate this envy and this anger everyone hates paying for medical care. Everyone hates how expensive medical care is. It's not the doctors getting the big benefit from that, right? Or I forgot to do that. That's another thing I'll bring up. They call these doctors no better than drug dealers, but somehow they forget to charge by the milligram or by the pill. Now, doctors who are truly drug dealers, they will say it's $600 for 60 of these, it's $300 for 30, $100 for 10. They don't see the patients at all. They just write the prescription. That is a true pill mill. There were some of them in Florida. They were quickly hammered, and justly so, right? If you're not actually caring about your patients, you're not actually evaluating. So they had to redefine what's a pill mill. So a pill mill went from those criteria to anyone who sees a lot of pain. That's every pain specialist on the planet and every primary care doctor who cares about their patients. Relieving suffering is the greatest calling of any physician. Being unwilling to relieve suffering in people who cannot be cured is an act of cowardice, in my opinion, but an act of cowardice that many, many of us will now choose because the alternative is terrifying.
Yeah, the fear of litigation overcomes the clinical sense of doing right by patients. Many who look at similar situations of physicians like yourself, myself, and others struggle to understand, why can't you just mount a defense? Why can't you just go in court and tell them what you are doing? Can you talk a little bit about how physicians are incapacitated from providing effective defenses?
The number one thing they do is they disallow your experts. Dr. William Bauer had 12 pharmacists, scientists, and doctors willing to testify on his behalf. They were all disqualified by the court. The pharmacists were disqualified because they weren't doctors. The doctors were disqualified because they weren't pharmacists. And the scientists were just disqualified for whatever reason. They find a reason. But their guy, they will pay some expert hundreds of thousands of dollars to sit there. And he's suddenly an expert in everything. So in my personal case, the expert they chose was an interventional pain specialist, not a medical pain management specialist, right? So when ER doctors go toward pain medicine, they're medical pain management. We're using medications to make your life tolerable. You've seen the experts, you've had the surgeries, you've had the spinal shots. Nothing's worked. We're just trying to help you get by, right? We might do a trigger point injection or a joint injection or something like that, but we're not going to usually stick something in your spine, right? Well, the interventional guys don't like that. They want you to hurt so you'll take another shot in your spine. Some of them think that that's really what you need. Others, just for reasons they think they are the only ones who should be allowed to treat these patients. So you get these two areas of medicine turned against each other. So you get an interventional pain specialist who resents anyone else treating pain coming into court, and they're saying, here's this guy from emergency medicine treating pain, and they're willing to say almost anything against your practice. I'll give you an example. At our clinic, we only accepted patients for opiate pain management if they were already on opiates. We would not start someone on opiates. I would send you to a pain specialist. If they started you, I would continue them. If you had seen an oncologist, there was an exception for cancer patients coming straight from the oncologist. So that was the only exception. So I thought, how in the world will they try to convict me when I have this incredible wall between me and starting someone on opiates, which is all the CDC guidelines apply to, by the way. It says before starting someone on opiates. It doesn't talk about someone coming in already on them, which they clarified in 2022, 3 weeks too late for me, by the way. So when you look at what they will say in court, they will say things that are non-evidence based and are clearly contrary to the objective practice of medicine. But they get away with it because your expert is disqualified. So I had the man who wrote the chapter in the Principles and Practice of Pain Management. He wrote the chapter on avoiding addiction and pain management. He had prostate cancer. He was willing to come there and be there for me. And I will always honor him for that. Dr. Wartenberg. Elderly man came in. He's ready. Prosecutor says, oh, he's just an addiction specialist. He's not a pain specialist. And all of a sudden, he can't talk about pain. He can't give an opinion about pain. But the government's pain specialist is allowed to give opinions about addiction, cough, and even I had a silent paging system so you didn't have to shout patient names just for privacy reasons. He said he had never seen that in a practice before. That was clearly outside the usual practice of medicine and indicative of me not even knowing the names of my patients. I'm like, oh, that wasn't it at all. But they can twist anything. They said I only treated patients already on opiates because it was easier to get them addicted. And I knew at that point, I had not yet got up to speak in my defense. I knew I was going to. I knew at that point that they were masters of this, of deception, of twisting, of persuasion, not evidence. There was no one, not even their witnesses. The witnesses they called got up and said, he's a good doctor. He cares about us. He tried to reduce our medicines whenever he thought it was necessary. Even sometimes we'd beg him to increase them. He would not. It did not matter. It did not matter because their expert gets up there and says, I looked at this MRI and this guy doesn't have real pain. And he should have known that. He should have known that. And I said, well, you can't. It's right here in the textbook, but you don't get to do that. The textbook is not allowed unless the guy who wrote it was there. And in my case, I brought the guy who wrote it because I had read up about what they generally do. He was still disallowed. Still disallowed. So they do this all the time. They have a formula set that works really, really well. And unless you have an outstanding health care, you are dead. If you use even a good attorney, even a great attorney that does not understand medicine and healthcare issues, you're almost certainly dead because they will believe what the government says. Well, why didn't you do this? Why did you continue benzodiazepines when they were already on opiates? You know that's dangerous. Right, prescribing dangerous medications in dangerous combinations is what physicians do. Safe medications and safe combinations are called over-the-counter, right? So that's literally the definition of being a medical doctor is that you have the right to do that. When you believe that the benefit outweighs the risk, and that's what gets lost in the process. So they will comb through 10,000 patient interactions and find 5 that went bad, right? Not because of something you did, but just went bad. Sometimes you can do everything right and things will still go bad. And they will bring the family members of that patient in to say, oh, you know, he was a happy man till he started seeing Dr. Parker, and then he went downhill. Well, why did he start seeing Dr. Parker? Well, his back was crushed and his hand was crushed. Well, do you think that might have had some effect on his enjoyment of life? Are you sure it was the medications and not the injury? But they've been convinced already. The DEA has, and that's another thing. The government has full access to every witness and every piece of evidence. They get to pay witnesses. They get to coerce witnesses. They get to threaten witnesses. You can't even talk to them. One of the first things they tell you is do not talk to any patients. Do not talk to any witnesses or you will get locked up. And you know you need to be at least free to participate in your defense. The second thing is the evidence. They will withhold evidence. They will say that they didn't think it was exculpatory, and that's all they have to say. And of course, they will say they don't think anything's exculpatory, right? Or we wouldn't be prosecuting them. So you will be given what they allow you to have. The witnesses to testify on your behalf are the ones that they permit. And so the playing field is so tilted that I wrote in one article, it looks like El Capitan. You are climbing a sheer face, right?
Yeah.
So that's what you're confronting. So if you take it to trial, it is not because you think you will be found not guilty. It's because you cannot tolerate the injustice of them. I'll tell you this right now, I wish I had been guilty of something. I wish there was something I could look back at and say, yes, I should have known not to do that, and I did it anyway. I felt bad about it at the time. I knew I shouldn't do it, because then I could have gone to them and I could have done what they wanted, right? And I tried to find some way, but the problem was I had been aware of them doing this to other doctors tangentially, and so I had set up a very strict protocol. A lot of doctors assume that they have the right to practice medicine according to their education, training, and experience. And you should, and the law says that you do. But saying that they can't do something when you're talking about the federal government is a terrible mistake.
Yeah.
They have incredible power, and who's going to stop them? Right? Congress. Congress can. The judge has some leeway, but even the judges have a very limited role to play in this. The prosecutors control the courtroom to a very great degree. And so you plead not guilty when you feel like you cannot tolerate the alternative, and when it goes badly for you. There are many, many nights where you feel like you made the wrong decision and you should have just gone ahead and lied to make them happy so that you can still be with your family and your friends. So I risked life in prison. Life in prison. A patient of mine had died in a jail 20 hours after he took his medicine, 7 hours after they had denied him any medical treatment, died of a cardiac condition, heart failure. He may have been having seizures from benzodiazepine withdrawals. That's very likely, because they found him foaming at the mouth, kind of shaking, moaning, and not moving. That's status epilepticus. They left him there for an hour. Came back. The next crew saw him in the same state. They called the fire department. Got him to the hospital. He died shortly after arrival at the emergency room. The coroner said, well, he had a 90% stenosis of the left anterior descending left anterior coronary descending artery, and that probably killed him, right? That the stress, and you can have stress-induced cardiomyopathy. So you can get arrested and be under stress. He was beating on the walls with his fists. He had been a prison guard. He was terrified to be in prison. He thought they were going to kill him. He said that on the tape. He was beating on the walls with his fists. They told him to quiet down. Then they found him in that state an hour or two later. And the government's expert toxicologist said that's not agitation. Beating the walls with your bare fists is not agitation. Wow. Begging for medical treatment is not, over and over again is not agitation. So anyway, so I was looking at life in prison, and so 20 to life is what it would have been had I been found responsible for his death. I went to court because I had to prove I was not responsible for his death. And though the jury was misled, and on 2 felony convictions and 2 misdemeanor convictions, they found me not responsible for his death. And no matter what they do to me, I had to do that. I was not the cause of my patient's death. The police killed him by denying him medical care. And the DEA helped him cover it up. And I find that terrifying, because we depend on the federal authorities to keep the police honest and to police them. So who guards the guards? Who watches those with the most power?
And as you know, this is very triggering for me, because as you know, in my case, that the local Munster police and the DEA effectively conspired and essentially falsified police reports so that they could then use a former employee to then write out an affidavit that they can then serve as a basis for the
that's another
DEA
thing.
raid.
When they come in there with those machine guns and they point them at all your employees, no matter how nice you were to that person, no matter how good of a boss you were, when they say he's going down, you might go down too. What can you tell us about him? I don't care how good a person you are. Your mind will suddenly flip and you're saying,
Yeah.
well, he didn't give me that one raise I wanted and he didn't give me Tuesday off. I'm going to roast him, right? To them, you're already gone. They're not hurting you. You don't have a chance. You're already going away. They may as well save themselves. So in their mind, you've both fallen off a cliff and they're hanging onto a branch and you've got a hold of their leg and they're going to have to shake you loose. They
Yeah.
justify it in their minds. And the DEA justifies it in their minds too. They're not bad guys in their minds. They're sacrificing a few innocent people, but won't that be a better warning to the doctors? And quite often the DEA will throw out, we only prosecute a few hundred doctors. Well, in 1995 it was zero, but now we only prosecute a few hundred doctors per year. It's in the big scheme of things, it's not that many. It only takes a few prosecutions of absolutely clearly innocent people, like Dr. Bauer, like myself, like you, where it terrifies everyone else. I can tell you, doctors called me crying, saying, I've seen some of your patients, I've seen your charts. If they came after you, I'm dead. And I told them, look, they told the Arkansas Pain Committee they were going to get 5 doctors. They've already got, I'm number 4. They're only going after 1 more. So chances are you're going to be fine. So change whatever you're doing. Call a healthcare specialist attorney. Follow every bit of advice he has. Get a clinic walkthrough so basically you get certified that you're doing things right. That can help. It's not guaranteed. They might still do it anyway because they know that the charge is enough to destroy your life. The charge will shut you down and cost you everything in your bank account. They can seize everything just by saying they think. They can seize all of your assets by criminal forfeiture, by civil asset forfeiture, by saying we think this is drug related. And they quite commonly they say this is how drug dealers look now, and they show a doctor in a white coat.
Yeah. Thank you for sharing and just being so honest. It's honestly triggering, but it's also therapeutic in many ways because having somebody like yourself advocating for what's right and protecting physicians is very important because your experience is almost an expertise at this point. You write quite prolifically, and I enjoy everything that comes. Daily Remedy, Kevin MD, all the media outlets that host your writing really do a service to the patients first and foremost. But I have to imagine that even you, with all your advocacy, still encounter times when people don't believe you or they appear skeptical of you. Talk through those moments, how you internalize that, and how you can, in many ways, combat that without coming across as too aggressive.
You have to read and study the Stoic philosophers and come to turn your perspective around from I'm going to have a good life, I'm going to take good care of my family, I'm going to be a respected member of the community, to I am going to be treated unfairly just like the witches in Salem, and I am going to be an example to my children of what an honorable person does when they are unfairly attacked and pilloried and destroyed in the media and everything. I will hold on to who I am. And I have to tell you, I write because of your book. I didn't write before. I read your book and it helped me. And I thought, by gosh, I'm going to write about what happened to me. And 46,000 shares later, I'm saying, well, I might as well write some more because people were saying, you put into words what I felt or what I experienced, and this helps me. If physicians had stood together, if the medical boards and pain committees, when the DEA came in and told the medical board to do things our way or we're going to hammer some doctors, if they had said you're violating 42 USC 1395, you're trying to influence the practice of medicine, you're breaking the law, no, it would have all stopped right there. But just like how a few guards can control an entire concentration camp, because each individual is afraid to rush the guards, right? A lot of doctors flip and point, right? And it always used to shock me during the witch trials. Why was everybody saying somebody was a witch? so they wouldn't be a witch, right? So I am very disappointed in my colleagues. The Marines are trained differently. I expected a little better. I expected that my colleagues would defend me, and one did. One stood up, and one that he was not my best friend, or at least I didn't think, but he was an honorable person. He stood up and said, I did the math. I've looked at all this. I've seen his patients. This is ridiculous. And he would raise his voice in the hospital hallways to defend me. Those are few and far between. Most
Yeah.
of them are going to say, Doctor, you have been charged and convicted with a felony. And we just have to. I mean, there was a doctor who said, psychiatrist. He came in and lectured at the Arkansas Medical Society meeting. He said, don't fire a patient if they have a negative drug screen. And after I was charged, I said, Doctor, would you come and testify that that's what you told us? Oh, no, 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 no. I can't get involved. So the cowardice of some of my colleagues I'm ashamed of, but at the same time, I've met some incredibly strong people who are fighting back and willing to speak out because it's the right thing to do. Not
Yeah.
necessarily. We hope to make change. But I look back at history, and the ones who don't speak out are not looked on favorably.
History will remember what we're doing. That is for sure.
This will be seen as a violation of basic human rights, both for the doctors and especially for the patients. Because these poor patients, by the tens of thousands, thrown out on the street with no one to treat them, because no one will touch you once your doctor's been hit. Because the DEA has said publicly that they will go after any doctor that starts treating you. So now you go out and you try to buy your pills on the market because you're in such agony, and you get these fentanyl-laced poisoning, and that's what caused the opioid crisis. I don't blame the CDC and the DEA for seeing prescriptions and overdoses doing this, paralleling and saying, I think they're related. What I blame them for is in 2012, when doctors self-corrected and the prescriptions started going down, we didn't need the 2016 guidelines. And then when the overdose rate skyrocketed as the prescription rate dropped, they should have changed course. They should have said, well, if we thought this meant A, and now they're completely divergent, then we were wrong. But no, they doubled down. The most common mistake in science is mistaking correlation for causation. The most common mistake in politics is doubling down when you're absolutely wrong, and that is what they've done.
And it's a testament to people like you who've been able to fight right and have your words heard and just be so effective. And in many ways, I'm very grateful for all that you've done. And I know that you and I, we've spoken many times and we share common relationship. I think that it's very important that a new audience gets to hear about your story and about your advocacy. And in the remaining time that we have, can you impart on social media docs, SoMeDocs, and the physician audience a few words of wisdom from your experience that you hope can resonate strongly?
The average physician treating pain and addiction is under the misapprehension that they are safe. There is not a single one of them. There's not a single doctor that ever prescribed a single controlled medication that I could not take that chart and, using the government's tactics that I have seen used in court, come up with an excuse to prosecute them. You are all practicing at the privilege and mercy of whichever law enforcement agent or politician with a badge wants to take your life away. It's not that you're a good doctor and you're doing the right things that you haven't been targeted. It's like deer hunting. You haven't come into their sights. That's all it is.
Well said. Dr. Parker, thank you so much for your time.
Thank you, sir.